Hey everybody, Tim Albrecht here, and thank you for listening to the YFP podcast, where each week we strive to inspire and encourage you on your path towards achieving financial freedom. On this week's episode, we take questions from the YFP community on Medicare and long-term care insurance, two critical yet often overlooked and, might I say, boring parts of the financial plan. We discuss when it makes sense to purchase long-term care insurance, what policies typically cost, penalties for late enrollment in Medicare, and policy changes and trends for both long-term care and Medicare that listeners should be aware of when planning for their future. Now, as we cross the midway point of the year, it's a good time to check up on your financial progress for the year and dust off those goals that you set back at the turn of the new year, which perhaps feels like a distant memory at this point. Whether you're focused on investing in the future, paying off debt, saving for kids' college, or growing a business or side hustle, our team at YFP is ready to help. At YFP, we support pharmacists at every stage of their careers to take control of their finances, reach their financial goals, and build wealth through comprehensive, fee-only financial planning and tax planning. Our team of certified financial planners and our CPA work with pharmacists all across the U.S. and help our clients set their future selves up for success while living a rich life today. You can learn more and book a free discovery call by visiting yourfinancialpharmacist.com. Again, that's yourfinancialpharmacist.com. Tim, welcome back to the show.
Good to be here, Tim. Let's do this thing.
All right. So at the time of this going live, we're actually on our annual YFP mid-year break. It's a week that we take off every year as a team around the 4th of July, a week that we can pause, reflect, get some time with family and friends. So Tim, any big plans for the family this year?
No, it's interesting, Tim. I'm reading Michael Hyatt's Free to Focus, and he's like, the way to kind of become focused is to do less. So I think it's a good time to kind of stop and reflect on the first part of the year, and then think about what's ahead for the second half of the year. We have some friends coming in town that have young kids, so we'll be spending the 4th with them, but kind of just staying home and hanging out. How about you? Any big plans for the Ulbrich family?
Yeah, we're hitting the road. We're going to see Jess's family up in Bowling Green to do some fireworks, 4th of July stuff, see her grandma. And then we're making a trip to Buffalo. My brother and his wife put in a new pool, so we're gonna enjoy that with them for a couple days and make the most of the week. So boys are super excited. Great age for traveling, and it should be a fun week. So hey, when you figure out the free to focus, let me know how that works. I need to figure that out. So
yeah, same.
So the genesis for today's episode is, Tim, you led a webinar for us a couple weeks ago on Medicare and long-term care insurance. And, this is a topic that I think we often think about. Of course, we know it's important, but it's one of those topics, both of these topics, where we're like, kind of boring. Like, how much do I have to really think about this part of the plan? But as you shared, I mean, the engagement, the questions, the interest was even exceeded our expectations, which was great. And so we decided, hey, let's do an episode that focuses specifically on the community members' questions around Medicare and long-term care. Now, we have talked about both of these topics on the show before. We'll link to these in the show notes. So episode 329, I brought on certified insurance counselor Josh Workman to talk about Medicare selection and optimization. He had some great insights to share from his experience helping people with Medicare selection. And then episode 296, Tim, you and I talked about 5 key decisions for long-term care insurance. So we're not going to rehash the background of these topics. Make sure to go back and listen to those, but rather jump into questions that our community had on these two topics. So Tim, let's start with long-term care. First question, which is probably, I think, the most common question, which is, when do I need this policy, right? So what is the ideal age range to purchase a long-term care policy?
Yeah, in the presentation that we did in early June, I kind of talked about this as like the Goldilocks zone, right? So if you're too early, it's not great. If you're too late, it's not great. So the way that I've broken this out, Tim, is you start discussing this in your late 40s, start assessing kind of policies and what you want to do, and kind of what is your plan for long-term care in your 50s, and then really kind of get the sweet spot to purchase a policy is in that 55 to 65-year-old range. If you're too early, you're paying premiums for a long time and you may not reap the benefit for 20 or 30 years. If you're too late, you're paying much more in premiums, or you could even be denied. So unlike most health insurance, you can be denied for pre-existing conditions. So there's really that zone, that sweet spot, so to speak, the Goldilocks zone, where you really need to kind of get this just right. And again, if if you have chronic issues, maybe you do that earlier. But I think one of the questions we'll talk about, what do these premiums look like? And I kind of have these at different age bands, so we can kind of talk about that. But start discussing in your late 40s, kind of start assessing, your plan in 50s, and then have a policy that meets that plan, in that 55 to 65 year range.
So Tim, we're officially in the decade. You said end
I
of
know.
40s.
Oh my goodness. Yeah.
So something we'll be thinking about here in the not too distant future, which is hard to
Yep.
believe. But let's talk about costs, right? Because I think sometimes these policies certainly can have some sticker shock. Everyone's situation, of course, is different. But what are we looking at in terms of average premiums of a standard long-term care policy?
Yeah. So before I get into that, like I think I think this was Lincoln Financial, did a study that showed like what couples are willing to spend on long term
Mm-hmm.
care insurance, and I think the number was like $2,500 to $3,000 per year in premiums. Um, so I had that in the back of my mind as I was kind of researching, this. So according to the 2023 long-term care insurance price index that's put out by the American Association for Long-Term Care Insurance,
Mm-hmm.
AALTCI, general estimates, and this is for a policy that has an initial benefit amount of 165,000. It grows at 3% compound inflation, so that's kind of the general baseline.
Mm-hmm.
Um, at age 55 for a single male individual, those premiums range from $1,700 to $2,100 per year. So obviously you're in that range of 2,500 to 3,000. Single females, unfortunately, ladies, your premiums jump quite a bit. You tend to live longer than men. Single female is actually $2,675 to $3,600, and then a shared benefit. So a couple that kind of combines their
Mm-hmm.
benefit together is $3,000 to $4,800. So that's at age 55. It jumps age 60, for a single male, goes from 2,100 to 3,000. So that's up from 1,700
Yeah.
to 21. Single female jumps from 2,675 to 3,600 to 5,000. And then the couple 3,800 to 5,500 in a combined. And then lastly, it's 65, single male 2,600 to 3,135. So that's a jump from the 2,100 to 3,000. Single male 4,230 to 5,265, and then the couple 5,815 to 7,150.
Mm-hmm.
So, and I would say, Tim, that the factors are influence these premiums. Probably the big one here is going to be the inflation protection. So it's probably
Mm-hmm.
the most expensive rider that's out there. And if you actually tie it, I don't even know if they sell them. I don't think they sell them like this, but they've been insurance products in the past. They'll actually tie it to the CPI.
Mm-hmm.
I think they don't necessarily do that. It's like, hey, you pick a 1%, 2%, 3%, 4%. That's going to drive the biggest cost to the premium. Age of purchase, obviously, as we kind of outlined here, is a big factor. Your health, so healthier individuals will qualify for better rates. The benefit amount and duration, so a highly daily benefit or a bigger benefit
Mm-hmm.
pool, and a longer period will increase your premiums. Elimination periods, I think we'll talk about this in
Mm-hmm.
another question. The shorter the elimination period, so think about this as a time deductible, or a deductible that's in time, results in higher premiums. I mentioned the inflation protection, and then additional riders. So other things that could be outside of inflation, shared care, will increase the cost. So these are kind of the factors. But I think all being equal, if we were to strip away the 3%, which again, that's a major rider, I think they become a little bit more affordable. And I think if you're looking at a baseline policy that will allow you to age in place, meaning like age in your home as long
Mm-hmm.
as humanly possible, I think if you can look at these policies almost as like a coupon for that care, not that, we talk about this a lot of people think like, oh, I need a 100% solution to put my kids through college, or I need a 100%
Yep.
solution for this. It's not about that. It's really about providing a baseline benefit for you that you can then pull the levers on other parts of your financial plan, of other assets that you have, to then form a fully comprehensive plan with regard to long-term care.
Yeah, and Tim, as you share that, it reminded me of bringing Cameron Huddleston on the show, who wrote "Mom and Dad, We Need to Talk." We had her on episode 321, navigating some of those financial conversations with aging parents. And some listening might be thinking about this as the coverage for themselves. Some listening might be thinking about this as, hey, what about my parents, right, that are aging,
Yeah.
and what do they have in place? And obviously, there can be a direct line from their coverage or lack thereof, and their own financial plan. And so, when you're talking about the different factors that can affect the cost, to me, what I also hear in there is like, we've got to zoom out and understand, like, what are the desires and the needs? What is the goal in terms of long-term care? Obviously, things may happen or not as we would like them to happen, but having some clarity on, you mentioned like care in the home versus a facility type of care. Like, those conversations are going to be really important for us to think about individually, but also with our parents, to then look at some of these policies and determine, what we want these policies to be doing in the coverage.
Right. Yep. Exactly right.
You mentioned riders a couple times. Before we go to the next question, can you just define that for those that may be a new term as they're looking at insurance policies?
Yeah. So riders are things that they're kind of like add-on features. So in an assurance rider, one in like for a life insurance policy, a permanent policy, or a disability policy could be like a waiver of premium. So like if you're deemed disabled, you could put a rider in that policy that basically says, if you are disabled, the policy will remain in force. However, you don't have to pay the premium.
Hmm.
For what we're talking about is um, cost of living. As things increase every year and inflation goes up, the policy kind of keeps pace with inflation, or at least
Yeah.
there's a flat rate. So all a rider is a additional feature that's bolted onto the policy that makes it more enticing to the policy holder. However, it often comes with expense. It comes
Mhm.
with an additional premium that's tied to that. So that's all a rider is.
Great stuff. So we talked about what's the ideal age range. We've talked about the average premiums, what goes into that cost, several different factors. You mentioned some of those riders, age of purchase, health, what the actual policy entails, elimination period. Let's talk about elimination period. That was one of the other questions that came
Yeah.
through is there an elimination period with a long-term care policy similar to what folks might be familiar with a long-term disability policy? So if you could first define elimination period and then answer that question.
Yeah. So the elimination period, as I mentioned, is kind of like, think of this as like when you get in a car accident and you are, say your deductible is $500 or $1,000, you have to pay that, as part, to kind of access the policy. So if I have an accident and I need work on my car that costs, 2,000, for the policy to pay out that 2,000, I have to actually pony up the deductible, which is, 500 or whatever it is. So
Mhm.
it kind of, what it's meant to do is create somewhat of a barrier to care. These policies don't want to be accessed or have claims against if they're nominal, if they're minimal. So in a long-term care insurance policy, you pay that in time.
Mm.
So to back up, when we talked about when the process of purchase on long-term care, I kind of broke this up into 5 steps. It's actually deciding when to purchase a policy, which we talked about. It's to choose kind of a monthly benefit.
Mhm.
The third one is to choose a deductible, which I'll break down here in a second. And then 4 and 5 is to decide how long the benefit will be paid. And then the fifth one is decide, what riders you want. Do you want an inflation rider or not? So to go back to step 3 of choose a deductible, deductibles come kind of in all shapes and sizes. So in terms of a time, you can get a deductible that is, the elimination period, I should say, that's the deductible in time, that is 30, 60,
Mhm.
90, 180, or 365 days out. The most common is 90. So the idea behind this is once a professional physician says, hey Tim, you need help with assisted daily living, like the task of transferring or
Mhm.
eating or whatever, then that's when the clock starts. So if I have a 90-day elimination period and the doctor determines that July 1, then essentially on October 1, and sometimes it takes another month to actually get the benefit, October 1 or November 1, that's when actually the policy starts to pay out. Now, what I just described was a calendar based, a calendar day elimination period. There's really two types. There's calendar day and then there's service day. So the calendar day is based on the total number of days from the start of needing care, i.e. that physician says, hey, Tim, you need care,
Right.
regardless of how often you use services, as opposed to a service day elimination period, which is based on the actual number of days you receive paid care. So when you think about long-term care, it's often intermittent care. You don't have someone
Mhm.
around the clock. Maybe they come in, 3 days a week to clean and help you do some things around the house. So there's pros and cons on each, right? So if you have in a service day care, if you have a 90-day service day elimination period and you receive care 3 times a week, it would take approximately 30 weeks to meet the
Right.
90-day. So versus like if you have, on that first example, July 1, I need care,
Yep.
October 1, I'm getting my policy to pay. So, there's pros and cons of each. Typically the calendar day is going to be more expensive than the service day. If you only need intermittent care and it's maybe even less than weekly, you need it once a week or whatever it is, then maybe the service day that works. So these elimination periods is all about trying to find, again, the Goldilocks zone for what type of care you need, what you want to pay for your policy, and then adjusting it for that. So that's the elimination period, Tim. So again, most common is the 90-day.
Mhm.
I think I'm not sure what is more common between service and calendar day. I think if you want more of a known timeline, then calendar is kind of what you want. But then, again, that's probably going to be more expensive when it comes to paying the premium.
Tim, as you're sharing all of these nuances and details regarding long-term care insurance policies, as can be the case with buying insurance, right? You pull back the onion and there's another question to consider, another question to consider of what the policy should be made up of, which all informs the cost, right? And what we have to answer the question when it comes to insurance, whether it's long-term care, long-term disability, life, whatever we're talking about, is what do we need and what do we not need? Right? Because obviously we want to have a certain level of protection that's going to protect the rest of our financial plan. But we also don't want to be overspending on premiums, that there's an opportunity cost that those dollars could be used elsewhere in the financial plan. And I think this is an important point to selfishly plug the work that we do and other fee only financial planners, where when you're engaging in that work in a fee only relationship, meaning that you're paying the advisor for the advice that they're giving, and there's not a compensation stream coming from the recommending of products that may or may not be in your best interests, we really can sit down and have these conversations of what do you need, what do you not need, without there being a bias in the
That's
advice that's
right.
been given. So
Yeah.
important.
Anytime that you have the overlap between advice and the sale of a product, there's going to be a conflict of
Yeah.
interest, because often that sale of a product, means there's type of a commission that's in
Yep.
place. And yeah, and I'll bring up one of the things. I feel like when I was presenting, I think the latest data says that a couple a couple that's age 65. Let's see if I can bring up the number. A retired couple age 65 can expect to spend after tax 315,000 on healthcare and medical expenses during retirement.
After tax.
Right. So and I think you might look at that and be like, oh, that's not that bad. But like a lot of people, I look at that, I'm like, that's a significant chunk of my, traditional
Mhm.
like portfolio. Right. So and the thing with this is that, the last time I looked at this a year or two ago, like these numbers, they've jumped significantly.
Mhm.
So I think again, if you're and this is like, if you think about like the biggest cost in retirement is really not like healthcare and medical expenses, it's housing.
Mhm.
So, if you think about this plus housing, that's a significant
Huge.
chunk of a lot of people's retirement nest eggs. So the idea behind, long-term care is to provide a baseline. Again, simple math. You could spend $3,000 for 30 years and spend 90 grand and give you that
Mhm.
baseline. And again, it can change, but to me it's about, again, getting those products in place for the plan that you're trying to design without kind of some of those strings that you mentioned that are attached to that. So um yeah.
Yeah, and this is, as you're talking to him, is all a good reminder for me. My conversation with my parents, we've had an open conversation. I know they have a long-term care policy. I don't know the nuances of the policy. I know they've been diligent in that work. I know it's something they've talked about. They've worked through intensely, but obviously the next level of that is to really ensure that my brother and I have a understanding of what's there as well.
Yep.
Before we move on to Medicare, last question related to long-term care is, are there any recent policy changes or trends in long-term care insurance that our listeners should be aware of when planning for their future?
Yeah, I kind of see three. The big one I mentioned already is, I think there's a big push towards the aging in place initiatives. The 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 longevity of a person, of a patient, increases when they can age in their home for as long as possible. And
Mhm.
actually, a lot of these policies, Tim, um, are really designed to provide as much care and benefits to do that. So whether that's setting up things like ramps or handrails or modifying the home
Mhm.
to make it better, to again, have more of a focus on in-home care than in a facility. Once you pivot to a facility, it's 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 better for you to stay in home as long as possible. So there's a growing focus on aging in place programs, um, and also that include kind of like wellness interventions like home modifications
Mhm.
and use of technology to monitor health and provide care remotely. So kind of more of the telehealth type of stuff. The second one is shift into more like hybrid policy. So there's an increase in preference for hybrid long-term care policies, which are often combining long-term care benefits with life insurance or annuities.
Mm.
So if you were to decide to peel off, a couple 100,000, $250,000 of your retirement portfolio to create a baseline floor. So,
Mhm.
what you get for Social Security plus what this annuity pays you for the rest of your life. There are riders that you can put in that also provides long-term care. So these policies offer more flexibility, and it's less about like a lot of people with really annuities and long cares, like you kind of lose it if you don't use it, right? So making them
Mhm.
more attractive to consumers
That's
compared to kind of a
interesting.
traditional policy, right? So that's
Mhm.
another one, is kind of that hybrid approach. um, and then the third one is, we're starting to see more chatter and action initiatives for public long-term care programs. So states like Washington have introduced public programs. Washington's called the Washington Cares Fund, which began payroll contributions in July of 2023. And basically what they're trying to do is provide basic long-term care benefits to residents. Um, so they have something in place, because I think the main misconception about long-term care is that Medicare is going to cover this, and it
Mm.
really doesn't.
Mhm.
So I think certain state governments are looking at this as a way to set aside money for residents to have some type of benefit in place
Yeah.
for the purpose of providing long-term care.
Great stuff, Tim. Topic we're going to continue to come back to, as I know there's lots of questions out there from the community. And since you mentioned annuities and that second update, and we've talked before about that concept of creating a retirement paycheck, creating a floor between Social Security and annuities, whether or not that's the right fit is another discussion. But we did talk about annuities on episode 305, Understanding Annuities. We did a primer for pharmacists. So if folks are hearing that, are like, oh, I want to learn more, we've covered that before. We'll link to that in the show notes. Tim, let's shift gears to talk about Medicare. And again, we've discussed this briefly on the show before, episode 329 with Medicare selection and optimization. Many pharmacists are aware of the different parts of Medicare from the work that they do every day. So let's jump into some specific questions. The first one being for Medicare Part D, is there, D as in dog, is there a penalty if you delay applying?
Yeah, so Medicare Part D is for like a prescription drug plan. So yes, there is a penalty if you delay enrolling in Medicare Part D. The late enrollment penalty is an additional amount added to your Part D premium, and it's calculated based on the length of time you went without Part D.
Mm-hmm.
Um, the big thing here, Tim, is that it's permanent. So once that penalty hits, it's going to hit as long as you have a Part D. So
Oh, wow.
the way they calculate it's 1% of the national base premium, beneficiary premium for each full month you went without coverage. So, and this goes up and changes every year. So, as an example, um, the in 2023, the national base beneficiary premium was $32.74. So that's not a ton of money. 1% of that is 33 cents. But if you miss 3 months, that's a whole dollar that you're
Yeah.
permanently paying on top of that. So it adds up. It's one of those things that you don't want to miss. So this is, again, if you forego enrolling in Part D, you want to make sure that you do that when your general enrollment comes up. So that's the penalty for Part D.
Yeah, and I think getting out in front of this, I've observed this, Tim, with my father-in-law, and in my conversations with Josh that we had on the show at episode 329. This is just it's a big decision. You mentioned the permanent penalty, but also this is people getting flooded with all types of information.
Right.
I think there can be a paralysis just with the overwhelming amounts of information. So starting this process early, making sure you're doing research, working with professionals that really understand this and have your best interest in mind is huge. The second question is, what are the potential penalties for late enrollment in Medicare Parts A, B, and D? We talked about D already. And are there any exceptions or circumstances where these penalties can be waived?
Yeah. So for Part A, most people don't pay a premium for Part A. That's kind of what your payroll taxes are, where you pay into Medicare while you're working. However, some people do, and if that's the case, you have a monthly premium that may go up by 10%. Um, and you have to pay the higher premium for twice the number of years you could have had Part A, but you didn't sign up. So again, most people they're gonna dodge this because they're not going to pay a premium. For Part B, again, just like Part D, there is a penalty, and it is permanent. So if you don't sign up for Part B when you're eligible, so this is your Part A is your hospital insurance, Part B is your outpatient. Um, the penalty is added to your monthly Part B. So you calculate this by looking at the penalty is 10% of the standard Part B premium. I think in 2023, the premium was essentially
Mm-hmm.
$165, 164.90. So 10% of that can add up, right? So and then the duration, you have to pay this penalty for as long as you have Part B. The penalty is permanent and will be added to your premium. So if you delayed signing up for Part B for 2 years, your penalty would have been 20%. 2 years times the 10% of the standard premium. So in this
Mm-hmm.
example, your monthly premium would be a penalty. It would have been 164.90, but then because you waited 2 years, the new premium is 197.88 cents. So more dire than the prescription, higher premiums, probably more punitive penalty. So this is really important as you are approaching your window. So just a reminder, your window, it's the months before and after your eligibility date. So I should have this here. Here we go. So individuals at age 65, it's a 7 month period. So it's 3 months before you turn age 65, the month you turn 65, and then 3 months after you
Mm-hmm.
turn 65 is your general or is your initial enrollment period. And that's where you really want to make sure that you enroll in A, B, and D at a minimum to avoid the penalties.
Great stuff there. Last question we have on Medicare, same one we heard on the long-term care insurance side. Are there any recent policy changes or trends in Medicare that individuals should be aware of when planning for the future. And I guess we should say, as we talk today, there's a presidential debate tonight. I'm guessing this will become a topic in the presidential elections, as it often is. So some of that will be hearsay, but anything that has been solidified or any changes that folks should be aware of?
Yeah, and I'm going to answer this, Tim, and I want to go back to some of the exceptions that I didn't answer for the question before. So really the only things that I'm seeing for Part D for Medicare is related to Part D. So starting this year, the 5% coinsurance requirement for Medicare Part D enrollees will be eliminated. So I think what they're trying to do is really go after high cost medications. So this is meant to reduce out of pocket. Beginning in 2025, there'll be a $2,000 annual out of pocket spending cap for Part D, which will also provide significant savings with regard to high prescription drug costs. And then the two other trends that I'm seeing is one's around consumer protection. So the government really wants to kind of crack down on deceptive marketing practices. So they don't want companies that talk about these plans to kind of mention specific plans, and more oversight for like agent and broker monitoring to kind of reduce predatory behavior. So kind of they want to prevent seniors from being pushed into a plan that they don't necessarily want or need. And then the expansion of telehealth and digital health education is another thing in Medicare that they're trying to focus on. To go back to the second part of the question that I didn't answer, where the penalties can be waived, there are certain circumstances where the penalties can be waived. So if you or your spouse are still working and you have healthcare coverage through your employer, you can sign up for Part A during a special enrollment period without a penalty. And the special enrollment period typically lasts for 8 months after employment ends or the group health coverage ends, whichever happens first. For Part B, it's the same thing. If you have coverage through an employer, that can be something that avoids the penalty. And then Part D, if you have like coverage through your employer or TRICARE, or you're a veteran, that will waive the penalty. And then if you are in a disaster zone, like a disaster, like they'll give you like a waiver for the penalty if you can kind of prove that you were there. Or the extra help, it's kind of a low income subsidy if you didn't sign up for Medicare, that's another waiver. But typically outside of those, you're gonna see that penalty. So that's to kind of round out that second question there, Tim.
Great stuff, Tim. Lots of questions and engagement from the community on this topic. Be on the lookout. We have more webinars coming throughout the year. You can always find information on our website, yourfinancialpharmacist.com. If you're subscribed to our newsletter, you'll get updates there as well. We'd love to have you attend one of our future webinars covering a wide array of different financial topics for pharmacists at all stages of their career. And if you have a question on these two topics or another question, feel free to send us an email, info@yourfinancialpharmacist.com. Again, info@yourfinancialpharmacist.com, and we'll try to tackle that on an upcoming episode of the podcast. Now, as we cross the midway point of the year, it's a great time to check up on your financial progress for the year and dust off some of those goals that you set back at the turn of the new year. If you're like me, that perhaps feels like a distant memory at this point in the year. Whether you're focused on long-term care insurance and Medicare like we talked about today, or investing for the future, paying off debt, saving for kids' college, growing a business or side hustle, our team at YFP is ready to help. At YFP, we support pharmacists at every stage of their careers to take control of their finances, reach their financial goals, and build wealth through comprehensive, fee-only financial planning and tax planning. You can learn more and book a free discovery call with Tim Baker by visiting yourfinancialpharmacist.com. Again, that's yourfinancialpharmacist.com. Tim, great stuff. We'll be back again next week.
Yeah, sounds good.
As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding materials should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of Your Financial Pharmacist unless otherwise noted, and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.